What is physician-assisted death? Also known as MAID, it provides an alternative for life. The assurance that terminally ill patients can die when they want based on their own criteria and can enjoy life for a longer time. The eligibility for patients is that they have to, one, make sure they're 18 years of age, two, have decision-making capacities, three, be able to physically ingest these medications, and four, they have to at least have a terminally ill, meaning they have to at least have 6 months or less of prognosis. As terms for physicians, they have to make sure that they confirm with the patient that they understand all the conditions. They have to inform the patients about the risks, the benefits, and the alternatives, and confirm that the patient has requested for the medication in a very settled and voluntary decision. And this is very important if either of the treatment of consulting physician suspects that the patient might be impaired in their judgment, they have to make sure that the patient takes a mental health assessment prior to that. While most states have only a general quote unquote assisted suicide statute, 6 states have enacted the statutes that target MAID specifically. Alabama, Arkansas, Georgia, Idaho, Ohio, and Rhode Island do not just outlaw assisted suicide, they expressly outlaw MAID specifically. Notably, during the 1980s and 1990s, clinicians were concerned that even long and consecutive treatment decisions like the do not resuscitate orders and withholding or withdrawing life-sustaining treatment might fall within the scope of assisted suicide prohibitions. But this goes back a very long time. So, like in 1906, the Ohio legislature considered a bill titled An Act Concerning Administration of Drugs, etc., to a mortally injured and deceased person. The bill applied to any of lawful age and any sound of mind who is so ill of disease that recovery is impossible or who is suffering great pain or torture. If 3 reputable physicians concurred with the patient's request to be put to death, then the clinician can administer an anesthetic until death ensures. The same year, Iowa considered a similar bill titled A Bill for an Act requiring physicians to take a human life. Now, there is 2 points that I'm going to bring out. There is a state court case and there is a federal case. So one that I picked was the state versus the Corcoran, which is happened in Michigan in 1994. And basically, there's a guy named Jack Corrigan. He was a very prolific litigant in the MAID movement. In February 1993, the Michigan legislature enacted a ban on assisted suicide. I'm going to call him Kevor. Kevor challenged the statute both in defense to criminal prosecutions and in action for declaratory relief. The Michigan Supreme Court reversed, upholding the assisted suicide statute. It held that the act was not constitutionally defective for having more than one object. Like the Court of Appeals, the state Supreme Court denied that the 14th Amendment included a constitutional right to die. The court held that there was a valid distinction between the right to refuse life-continuing treatment and the right to insist on life-ending treatment. As for the federal court case, it's SCOTUS of Quill versus Vaco. In 1994, advocates filed 2 federal lawsuits challenging the constitutionality of Washington and New York statutes criminalizing aiding suicide. The Washington and New York lawsuits claimed that the criminal assisted suicide statutes constituted denials of due process and equal protection as applied to terminally ill, competent persons voluntarily requesting assistance from licensed physicians. The U.S. Supreme Court reversed, holding that there was no fundamental liberty interest in that New York's distinction between active and passive means of death was legitimate. Moreover, while acknowledging the difficulty of its task, the court distinguished between the refusal of life-saving treatment and assisted suicide by noting that the latter involves the criminal elements of causation and intent. It found the distinction between assisting suicide and withdrawing life-sustaining treatment to be rational, one, because it is a quote-unquote distinction widely recognized and endorsed into the medical profession and our legal traditions. The legalization is made in the United States is a train that has left the station. It will eventually reach most of the 49 U.S. jurisdictions when it is not yet legal. So this can be, for instance, Texas, who has not yet contributed to MAID and the benefits of it.
At the age of 20, David broke his neck in a swimming accident. In 1971, he acquired a spinal injury that rendered him a quadriplegic with little use of his arms. And in 1986, a spinal aneurysm developed which left him paralyzed and on a ventilator. In 1989, David requested a physician-assisted death, but the judge refused, stating it was a refusal of medical treatment. He was then forced into a nursing home, which he called the ultimate imprisonment. David spent his days confined to a bed with little to no freedom because of his condition. He saw this as a cruel semblance of life that was not worth living. Due to the lack of support from the system, David took his own life. The unimaginable hurt this caused him and his family could have been avoided had PAD been approved. PAD gives those with undurable conditions an opportunity to take back their freedom.
The primary theme of Martin Luther King Jr.'s letter from Birmingham jail is that civil disobedience and direct action are a necessary response to injustice. To those who are in favor of physician-assisted suicide, laws that present physician-assisted suicide are unjust. Physicians and patients who participate in physician-assisted suicide, especially illegally, are taking the necessary steps to fight against the injustice that is the illegalization of physician-assisted suicide. In a quote from Martin Luther King Jr.'s letter from Birmingham jail, "We should never forget that everything Adolf Hitler did in Germany was legal, and everything the Hungarian freedom fighters did in Hungary was illegal. It was illegal to aid and comfort a Jew in Hitler's Germany. Even so, I am sure that, had I lived in Germany at the time, I would have aided and comforted my Jewish brothers. If today I lived in a communist country where certain principles dear to the Christian faith are suppressed, I would openly advocate disobeying the country's anti-religious laws."
Hi, my name is Savannah Thomas, and I am doing the slide for pro-assisted suicide. People have a right to die a peaceful death. Death by assisted suicide is the kindest way to end someone's suffering. Many people are diagnosed early on with a terminal illness, whether it's cancer, mental health disorder, or, somebody just needs help every single day of their life. They can't do nothing by themselves. With that being stated, assisted suicide is not for everybody and not being forced upon anybody. It is just to have an available option for those who need or want to end the pain and suffering they endure in their everyday lives. People need a chance to be able to say goodbye and to know that their family has a peace about themselves knowing that they went willfully. Making assisted suicide available both helps the person who wants the suffering to end as well as the family. They both get a chance to go through to make arrangements for themselves, such as funerals, getting all their priorities in order, as well as getting everybody a chance to say goodbye for the last time, letting them to be at peace, instead of having to get the phone call in the middle of the night or the person dying a horrible death by themselves.
Hi, I'm Olivia Bigham, and I am argument number 8. When a person is not showing signs of getting better or has spent years in pain or there's no cure, physician-assisted death provides a justified option to stop the pain on their own terms. It allows a person to have control over when, how, and the circumstances of their own death. So they get to choose, and it's a lot better on the mental part of the situation. By legalizing, it could reduce suicide by other means, instead of the patient having to do it themselves or feel like they have to do it themselves in a more harmful manner. In the future, if it were to be legalized, it can be organized to regulate the practice by creating ethical guidelines and training to prevent any type of abuse towards physician-assisted death.
Argument number 9 by Christian Allen. Brittany Minyard, who was 29 years old, who suffers from terminal brain cancer, has become more and more unresponsible as the days went by and wants to end her own life because she doesn't want to have to do everything through a wheelchair and not to do the simple things on her own, like brush her teeth, wash her face, take a shower. So how could we tell them no to not wanting to be here anymore? What can we say when an 85-year-old asks to end their own life? Tell them no? When they can't even use the restroom on their own, or without having a diaper on, even get out of the bed without help. I believe it should be legalized for those reasons I just explained.
Our group's key moral values are: everyone has a right to live a life that they think is worth living. Everyone has a right to not live a life that they think is not worth living. People should be able to make decisions regarding their own death. And someone should be able to end their own suffering, and other people should not be able to prolong someone else's suffering as long as the person ending their suffering is not causing harm to anyone else.